my name is Valentina and today I will be performing wound care. So this is my wound right here, and for this video's purpose, we're gonna pretend that there's already an old dressing on this wound, and I will be taking that off during this procedure. This is a sterile procedure, so we are gonna use the sterile technique. Okay, so I first start by knocking on the door, and the patient might tell me to come in. Then I would introduce myself. Hello, my name is Valentina, and today I will be your student nurse. I would explain to them why I'm here. Dr. Smith asked me to come and perform my wound dressing change on you. So then I would ask the patient to please tell me their name and date of birth while looking at their wristband. And I would also ask them to please let me know if they have any food allergy, latex allergy, or medication allergy. I would also perform a second identification later on before initiating the procedure, and this consists of me comparing the information on the wristband to the information on the paperwork. Okay, so then I would wash my hands. I would close the curtain to provide some patient privacy, and I would raise the bed to a working position, and I would put the rail down. Okay? So then I would put on these regular clean gloves on. These are a little small. Need to be perfect. And then I would ask the patient if there's any culture consideration I should be aware of. Okay. Then I would let the patient know that I will be exposing them, like exposing the area where the wound is. And to please not touch or scratch the area, since this is a sterile procedure, we don't want to contaminate. If there's any itching, I could always ask the doctor to prescribe some Benadryl for it. Okay. So then I would expose the patient, and then I would look at the wound, the old dressing, and carefully I would start releasing the old tape from the skin. If it becomes really hard to do that, I can always use some dehiscent solution, like to make it easier. Okay. After releasing the tape, we're just gonna leave the wound dressing like it is. We're not gonna take it off yet. Okay. So then I would say, like, I see no excess drainage coming out of the dressing. Okay. So then I'm gonna look at my kit. I'm gonna make sure it's intact, that it's not open. I'm gonna look at the expiration date. Okay. And then, since this is a sterile procedure, you wanna open it away from you. So I wanna open it away from me. Take this one out because I'm going to need it. And inside of your box, there should be a higher hazard bag. And I'm going to ask the patient if it's okay if I can put this next to them, so I can throw away everything. Okay. And then I am going to measure the tape that I'm going to need. And since this is an abdominal wound, I am only going to use 3 pieces of tape because I don't want to put any tape near the patient's pubic area, as it can be very painful. So some pieces, and then on the piece that I will be placing on the top of the dressing, I'm going to write my name, date, and time, so the next nurse that does the wound dressing change knows that it was me who performed the last one. Okay, so after doing this, I am going to take the dressing off. So it's going to be from top to bottom, and then I'm going to say there's no smell. I'm going to place it on the palm of my hand and fold it, and then pinching the glove, I'm gonna take it off like this and then slide my fingers underneath so my hands don't touch. And I'm gonna throw that into the hazard bag. And in the gloves should be the dressing, okay? So I'm gonna wash my hands again. And then now I'm gonna begin my sterile procedure. So I'm gonna start by grabbing my sterile gloves, okay? Dropping like this. So using this 1-inch border, I'm gonna open them. And like kind of like a twister, you wanna start with your dominant hand. So you're gonna put them on. It doesn't have to be perfect the first time, and then just leave them like that. Then you're gonna kind of do a hitchhiker. And a little scoop. Okay. Then you want to grab and drop it because you don't want to put your hands below your waist. Okay. So then I'm going to look at my wound. I see no redness, no edema, no ecchymosis. There's no drainage, and the approximation is present, okay? So I'm gonna count the sutures. This patient has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 sutures that are perfect. They're not rupture or anything. So in my little box, there should be a ruler, which I'm gonna use to measure the wound. And the wound's approximately 16 centimeters. And then I'm gonna throw this in the hazard bag, okay? So then I'm gonna grab my solution. I'm gonna make sure that it's not expired or open. And then I'm gonna open it. And I'm gonna pour some into the box in a special little compartment. Okay, now inside the box there should be about 3 gauzes that you're gonna use to clean the wound. So you wanna fold them into a triangle. You're gonna dab it, take off the axis, and you're gonna start medial, then distal, then proximal. So then medial, 1, 2, 3, throw in the hazard's bag. Now you're gonna do distal, 1, 2, 3, and last but not least, you wanna do proximal, okay? So, 1, 2, 3, perfect, okay? So after that, your wound is ready to be dressed. Okay, so you wanna grab your abdominal pad, and you wanna place the side with blue line on top. It should be like this. You drop it, okay? Now you can take off your sterile gloves, throw them in the hazard's bag, and then you want to wash your hands again. Wash your hands again. And then you're gonna put on regular gloves. And then you're gonna start placing the tape on it. And this is how it should look. Okay, perfect. Now I would cover the patient back up. Put the side rail up and lower the bed to the lowest position. I would take these gloves off. I would ask the patient if they need anything else. I would let them know that someone will be coming in later to check on them, and I would wash my hands before leaving the room. And that is it. That's how you perform wound care. Thank you.